Here we go. Welcome, everyone. My name is Adrianne Finley Odell. I'm the head of school at Roycemore School. We're so glad to have so many of you join us this evening to hear about our reentry plans for the fall. And we've had a lot of work going on over the last couple of months. A lot of people have put a lot of great thinking in place, and we feel pretty excited about what we have to share with you. Hopefully many of you have already had a chance to take a look at our health and safety plan and our academic reentry plans. Those plans were developed first and foremost with the health and safety of our students and our faculty in mind. And then everything else really flowed from that first and foremost priority for us. While we still have COVID in our midst, we can't be cautious enough to make sure that school is a safe place for our students and our teachers. And we did hear from our families that you want your kids back on campus. And so that was another guiding principle for us. There are some families who are electing to have their children participate in the off-campus learning option. And there are some families who have already told us that they're not sure, but they're going to hold their spot on campus and kind of see what happens. And what we wanted to do was to provide a plan for all of you so that you could have the utmost confidence as your kids return to school. We wanted to get the plan out early to you so you can make those decisions, and also hopefully lessen the anxiety that we know all of us are feeling. A lot of stress, a lot of anxiety during COVID, and recognizing that many students had months where they were off campus and we want to get them back on campus. So that was our first priority, and then everything else flowed from that. We put out the questionnaire for all of you to let us know whether your children wanted the off-campus or on-campus learning options for the fall. So far, we've just had over 100 responses. So if you haven't yet responded, please do respond to that survey, because it's going to help guide us as we plan for the reentry in the fall. And we are committing to keeping class sizes small so that the students can socially distance in the classroom, and the cohorts also small. And we'll get into the details of that. For tonight, our approach is we're going to start with sharing some of the highlights from our health and safety plan, and then we're going to move into the academic reentry plans for middle and upper school. So I'm pleased to turn over the mic to two members of our health and safety task force. The chair of our health and safety task force, Tom Ellis, who just stepped down after 15 years as chair of the board of trustees, has served the school for a long, long time. Both of his children graduated from Roycemore, so he's a parent of two proud alumni. And he wasn't quite ready to give up his engagement with us, so he's continued to be involved with us and has taken on this mighty task to chair our health and safety task force. And with him is Dr. Anita Shah, who is a parent of a child in our early childhood program, but also has been working on the front lines of COVID as a critical care pulmonary doctor. And so she has really firsthand knowledge and expertise that she has brought to bear that has helped guide our thinking. So with that, I'm going to turn it over to Tom and Anita.
Okay, well, I'll take the ball and run with it first. I appreciate all of you being on this evening. And while much has happened over the last several months, you may recall that the first case of COVID-19 in Illinois, which was actually the second in the United States, was confirmed back on January 24th of this year. However, Roycemore's administration board of trustees had already been dealing with health and safety issues from the disease due to our international student population, which included a student who had returned from the Hubei province near Wuhan after winter break last year. And in fact, Adrienne was already writing to our Roycemore community about COVID-19 health and safety issues as early as January 29th. And while the Board of Trustees and administration initially were addressing the issues on an ad hoc basis, it quickly became apparent we needed a comprehensive and formal approach to COVID-19 and all its related issues. So the Board of Trustees established an overarching COVID-19 strategy team, which included a specific health and safety task force comprised of individuals with particular subject matter expertise. In addition to me, the task force consists of 7 other individuals who are contributing their time and talent. We have 2 physicians. First is Dr. Anita Shah, who's with us tonight. And as Adrienne mentioned, she's board certified in pulmonology and specializes in critical care medicine. We also have Dr. Lakshmi Halashamani, who's board certified in internal medicine and serves as Chief Quality and Transformational Officer for North Shore University Health Systems. We also have 2 attorneys, Deborah Pergamet, who's affiliated with the Children's Law Group in Chicago, and Stephen Jackson, who is affiliated with Howard Brown Health in Chicago. We also are fortunate to have 2 heads of school. We have Adrianne Finley Odell, who needs no further introduction and is just simply an amazing partner to work with. And then Tim Costello, who is head of school at Science and Arts Academy in Des Plaines and is also serving as president of the Lake Michigan Association of Independent Schools. Rounding out the group is Vicki Pickett, who is Roycemore's Director of Finance and Operation, and she provides much needed assistance with supply logistics and for health and safety equipment and devices, and for budgeting and implementation of plans. So we have a great group there, I believe. The task force was charged by the Board of Trustees with ongoing collection and analysis of relevant information regarding COVID-19, particularly relating to pre-K to 12 schools. Also providing reports and recommendations to the Board of Trustees on these issues, and developing the health and safety reentry plan for resumption of school in the fall, whatever prevailing conditions may exist at that time. The task force meets as often as warranted, but no less than once per week, usually on Wednesdays at 7 a.m., which is tremendous considering everybody gives their time freely. But we need to do so to stay on top of all of the developing issues. The collaboration among the task force has been tremendous. I'm particularly proud of the health and safety reentry plan the task force developed that was published on June 3rd. This was the first such plan published by any school in the Lake Michigan Association of Independent Schools, and I believe in the state of Illinois, by any independent school in the state of Illinois. This plan has also served as a fundamental model for our sister schools and established Roycemore as a leader in health and safety issues. I hope you've had an opportunity to review the plan. In any event, Dr. Shah is here and she will discuss some of the key provisions of the plan. So with that, Dr. Shah, I'll turn it over to you.
Thank you, Tom. I just wanted to thank both you, Tom, and Adrienne for inviting me onto this task force as a parent of a child who's in the earliest grades and probably has that age group has the most difficulty social distancing and wearing masks. There was a lot of anxiety on my part, just as a parent, about how he's going to go back to school. And then, obviously serving on the task force, has been very enlightening, and we've done some good work, but I'm proud as a parent of the work that we've done. And I am satisfied as a physician and a parent that we're making it as safe as we can, and that I'm going to be perfectly happy sending my son back to school next month. I just wanted to talk about the health and safety aspect. As an overview, there's 3 kind of broad categories, and then obviously as questions come up, we can take them. But they're really broken down into protect, distance, and disinfection. Protecting goes hand in hand with prevention. We're in a unique position as a small school, and my son's only been with the school for a year, but I'm impressed by the community feel and the commitment that everybody has with one another about keeping everybody safe. And, the first thing we need to do is obviously prevent individuals from getting sick, but then bringing it into the school. And the way we've tried to do that is, closely aligned with CDC and WHO recommendations. But important things that will happen every day for any child or adult really entering the school is first morning attestations that your child is healthy. And there's a list of symptoms that I won't get into right now because the symptoms of COVID are broad, but that you will have to, write down, or I think there's going to be an app to say that your child is healthy, and that there's been no, as far as COVID positive exposures. When anybody, but particularly children enter the school, they'll all be temperature checked. If your child has a fever greater than 100.4, they will not come into school. Now that goes for anybody. So any individual employees, any contractors, any workers coming in to the premises will all be symptom and temperature checked. This is in alignment with what happens in all the hospitals across the country, what happens in mine. I get temperature checked every time I walk in the door. And then the key piece, I'm sure, if anybody's been watching the news today or over the last few days, the WHO finally kind of admitted that COVID is, airborne. I think we've sort of, at least in the healthcare community, have known this for a long time. You could see pictures of, people spraying down the streets in Wuhan, China, and everybody's like, well, why are they doing that if it's not airborne? But the thing that will protect us all is the masking. And with that, everybody who enters the school will be required to wear a mask. Children from, the pre-K all the way through high school, the teachers, anybody else coming into the hospital, food service workers will be required to wear a mask. Indoors for sure, and outdoors if they are unable to socially distance. Now the benefit of being outdoors is there's a lot more space. They don't necessarily have to be masked. One of the other things, probably more important in the lower school, will be minimizing the sharing of stuff, if you will call it, supplies. And so each child will have, their own set of supplies or things that they need to learn. I think a big education piece, and it's going to be something that will be difficult in the beginning, especially for some of the younger kids, is just education about not touching your face. If there is there's COVID in the community, but in the school, if there's a child who is asymptomatic and there's COVID on the surfaces, one way to prevent transmission is by avoiding touching your face and putting your hands in your mouth and that sort of thing. I can tell you when all this started back in March as far as the hospital is concerned, and we started wearing surgical masks for 12 hours a day, you truly find out how many times you touch your face in, over the course of the day. It's a lot. So there will be some learning and reminders as that goes along that will help, even if you do come into contact with a COVID positive surface, as long as you wash your hands with soap and water or gel, you should be fine. The second part is the social distancing. I sort of touched on this before, but maintaining the physical distance whenever possible. I think Roycemore is in a unique place to do that, and compared to some of the other public schools that just have many more students and limited space. So the desks will be appropriately spaced out. The plan is for students to eat lunch in their classrooms, contactless lunch, and unfortunately, some of the things that were happening before, cross-divisional mixing and some of the programs that were happening will probably have to be minimized initially, just to prevent, students kind of with too much interaction. The goal, sort of keeping the same kids in contact with each other on a daily basis, almost like a little family of students, and trying to minimizing exposure to other people. And with that goes along, when possible, the teachers moving to the students instead of, 20 students walking through the hallway, classroom to classroom. And then obviously easier when school starts and when the weather is warmer, but trying to maximize outdoor space as we can. And then there's been a robust discussion about, the disinfecting procedures. Vicki Pickett has done an excellent job, and Tom, in trying to, get all the stuff that the school needs for disinfection. Kids will be required to use hand sanitizer upon entry to the school. The first week of school will be educating them multiple times regarding appropriate hand hygiene, respiratory hygiene, obviously not, coughing into open air or sneezing into open air. I encourage parents to send their children to school with more than one mask in case their mask gets dirty, lost, dropped on, stolen, whatever. So they have that throughout the day. And then just as a parent, one of the things I've been sort of working with both of my kids, I have a 4-year-old and a 2-year-old, is as the summer progresses, is when we go out, even though we're not coming into contact with anybody, having them wear a mask just so they get used to it. And, my son really likes to pull it down over his nose and things like that. And it's very common. So it'd be, helpful, I think, for him, and this is why I've been doing it for at least a month now, is getting him used to, wearing a mask so it's not a problem throughout the day. It's something that people definitely will need to get used to. But I'm pleased with the progress we've made, and I'm impressed at how Roycemore, from just taking my medical training aside, just from a parent standpoint, I'm very happy at what Roycemore has done, and I feel comfortable sending my son to school next month. And I'm probably more conservative as far as like the medical aspect of, I don't want to go anywhere, I don't want to do anything, I'm really careful. So that's really the summary that I wanted to provide.
Dr. Shah, thank you so much for sharing that. Super helpful. And Tom, thank you also for sharing a lot of the background about the work that's been going on here at Roycemore. We are so fortunate to have such an amazing team who was pulled together to create a really solid plan for us. But to make that plan really work needs all of us as a community to do our part. And we recognize that our campus is one location, but all of our kids go home to you at the end of the day and interact with other folks. So one of the things that we're asking is for our families to really commit to thinking about us as this bigger community, and each of us doing our part, not just while kids are here at school, but off campus as well. And we will be including a pledge as part of the student parent handbook this year that just requests our families to be all in with us on this. We recognize we can't have a 100% safe place, completely zero access to COVID. But when each of us wears masks, when we socially distance, when we have good hand hygiene, if we are traveling to places that are COVID hotspots, that we quarantine, as the city of Chicago has put that mandate in place for folks. If we all do those things, we hopefully will come out of this in really, really great shape. And so we are asking everybody to really pledge in their own families to be a part of all that we're doing here. With all of the work that we're doing to keep Roycemore safe, we're getting more and more interest in enrollment at the school in the fall. And so I again want to encourage, if you haven't already responded to the survey to secure your child's spot in class in the fall, we've set the deadline of July 31st to let us know so that we can plan for it. But we are not going to admit any students that we don't have those spaces for. And as of right now, we're only 10 spots away from being full in middle school. And it's also increasing in upper school. We have a few more spots in upper school than that because our middle school cohort, we're limiting to 70. Our upper school cohort, we're limiting to 100. So if you have families that who are interested in us, please have them go ahead and reach out so we can get through the process. And if we have space in the class that they're looking at and the grade they're looking at, and they are an appropriate fit for Roycemore, then they could potentially be part of the school this fall. But we expect that it's going to be, that we'll be full to capacity. And we're excited about that, but also excited that we can provide an environment where we can have that social distancing and all of these safety measures in place. Dr. Shah mentioned an app, and I want to give a shout out to our rising senior Effie Zimmerman, who has created, after we had a conversation at the beginning of June, an app, a school wellness screener app that all of you and your students will use before coming onto campus every day. And it will be an attestation of being symptom-free. Now, some of us have chronic issues like asthma or allergies or things like that. And so we will work around those kinds of symptoms, but we're really looking for symptoms that are COVID related and to make sure that we don't have anyone coming onto campus that could potentially be a carrier of COVID. But Effie's app is already being signed up by schools all across our country who are excited about what one of our students has created. So I'm really thrilled about this leadership that has been demonstrated by one of our own students. I am now going to turn over the mic to our division heads, but before I do that, I want to let you know we're going to have Q&A at the end of this conversation. And so if you have any questions related to the health and safety plan, you can use the chat feature to address those questions. And while our division heads are talking, I will go through those questions and be ready to address those to the team. And so now I'm going to introduce Stefanie Rivera, our upper school division head, and welcome, who just arrived in Evanston in the last week, relocating from Pittsburgh, Adrienne Floro, our new middle school head.
Hi, everybody. So I'm not going to talk very long, and just, all of this information is in our reentry plan as well, but I just wanted to go over the new schedule a little bit and talk about the cohorts, and then I'll hand it over to Adrienne Floro, and she'll talk a little bit about some other items. So when we were looking to figure out what we were going to do, one thing became abundantly clear, and that was that we wanted to keep the in-person schedule as close to possible to the remote schedule should we have to go fully remote, right? Like we're back in phase 3 and Pritzker closes all the schools, right? So we started there, but then we also looked at a ton of research, feedback that you all provided and that students provided on surveys. And thus, we came to the conclusion that a block schedule would be much more conducive to learning and growing, and to a remote setting. So basically, what the schedule is going to look like on Mondays and Wednesdays, so this is for upper school and middle school. Mondays and Wednesdays, it's A, B, C, D blocks. And then Tuesdays and Thursdays, it's E, F, G, and Eagle Hour. I'll talk about Eagle Hour briefly in a moment, but we'll just look at the schedule for now. So classes run 80 minutes. There are breaks between. Lunch happens. Lunch will be separated, obviously, and there won't be food service in the dining hall, but lunch does happen. So classes run 80 minutes, and that's true Monday, Wednesday, and true Tuesday, Thursday. And then on Fridays, we actually have all classes on a pretty regular schedule. They go all the way through. It's about 45 minutes per class. So in end effect, all classes meet 3 days a week. It's the same amount of time, more or less, minus like a few minutes that we've always had. So class time is not significantly less. It's just a different way of teaching and learning. And so that's basically what the schedule is going to look like. Within there, your students will still have advisory. Advisory is going to meet on Thursdays during lunch. So they're all going to get to have lunch with their advisor and their advisory. And then we'll also have our SEL programming and our regular advisory stuff happening at that time. It will just be during lunch. I lost my thread. And then Eagle Hour is a pretty cool new thing that's going to happen after G Block on Tuesdays. It's a class, but it's fun and exciting, and we're putting together a list of offerings based on student interests. So, for example, it'll be things like social justice, sustainability, community service, cooking, yoga, drama, theater stuff. So there will be a list of options available to students that they can choose from during that Eagle Hour. And that'll be on Tuesday. And then on Thursdays, we still end the day early because we're very committed to professional development of our teachers and, of course, faculty meetings. So that's the basic schedule. And now I'll move into the cohorts, which Anita already addressed. Thank you, Anita. But I'll just kind of break down what the cohorts look like. So these are groups of students that move together and do not move through, right? So the first cohort is early childhood. That's pre-K, JK, and kindergarten. Next cohort is 1st through 4th grade. Next cohort is middle school. Next cohort is upper school. So basically they track through the building just with that group, and areas such as that are normally common areas like the gym, the NPR, the library are not common areas for next year. So basically the gym will only be used by middle school students and upper school students and will be cleaned in between. The NPR will only be used by middle school students, and the library will only be used by upper school students. So that's basically how those cohorts work. Like Anita said, they're little families. And Ms. Floro Adrienne Floro, is going to talk about, there are some middle school students who take upper school classes, so she's going to address that. So I'm going to go ahead and hand it over to her. Take it away, Floro.
All right, thank you so much, Stefanie. I don't need to share my screen, do I?
We can see
Yeah.
you.
Okay, great, you can see me. Well, first off, thank you so much for the warm welcome. I am absolutely thrilled to finally be here and anxious to come to know and work with you and your children in the coming weeks, months, and years. So I'm talking a little bit about the dedicated spaces in the building. Stefanie did a great job talking about those. The one thing I just wanted to point out is in terms of the building, we are using directional arrows and clear markings throughout the building to really, again, make sure that students are only coming in contact with other students that are in their cohort. So things will be very clearly labeled, pathways will be clearly marked. And I'm going to speak specifically about the locations for both the middle school and upper school. Stefanie alluded to this a little bit. The middle school, the students will be obviously utilizing the second floor middle school wing, certain fine arts rooms, the NPR, and the gym. Adrienne has already mentioned that the maximum cohort size is 70, but we will not gather in groups of larger than 50. The upper school will be using their second floor wing, the science labs, the fine art rooms, the library, and the gym. And as Stefanie mentioned, the middle school and upper school will both be sharing the gym, but it will be cleaned between uses. The maximum cohort size for the the upper school is 100, but as with the middle school, they will not have gatherings larger than 50. And as well as we can, with the cooperation of weather, we're going to be utilizing cohort-specific outdoor spaces whenever possible. And any space, including the gym that is used, it will be cleaned between cohort uses. So next I'm going to talk about middle school students who participate in upper school classes. So we're talking about students that are in world language or math in the upper school. They will be taking their classes in a dedicated middle school cohort classroom. The teacher of that course will travel between the middle school and upper school cohort areas to work with their students. When the teacher is with the upper school students, the middle school students will work remotely under the supervision of a staff member. And similarly, when the teacher is with the middle school students, the upper school students will work independently, remotely in the upper school cohort area. Stefanie talked about our block schedule. That's really an asset in terms of being able to adjust for our students that are middle school taking upper school classes. By having 80-minute blocks of time, it allows the teacher to have more flexibility in terms of working with students in both areas on their coursework. So we feel very comfortable in being able to manage having one class functioning in 2 locations in our building with the teacher traveling between, again, ideally minimizing the cohort interaction. And that is my piece, and I'm going to turn it back to Adrianne Finley Odell.
Thank you, Adrienne Floro. We are going to have a lot of fun getting used to 2 Adrians in the building. We are already figuring that one out. All right, so there have been a number of questions posed in the chat. Thank you, everyone, for posing them. I'm going to try to go through them and address them to our team here as appropriate. So I'm going to start with some of the health and safety questions. And if you have follow-up questions regarding the academic plans, just go ahead and add those to the chat. So one of the first questions had to do with air handling and negative air pressure and UV lights. Dr. Shah, would you like to address that question?
Sure. So I don't think that the school is, retrofitted or there's any plans, at least that we've discussed, to make the school negative pressure. Personally, from a medical standpoint, I've been taking care of COVID patients for the last 4 months. And to be honest, even when they're admitted to the hospital, the majority of the patients aren't in negative pressure rooms simply because Every hospital usually just has a handful of negative pressure rooms. It's important, I guess, to emphasize that this is where the mask issue is really important. You know, a surgical mask, if I'm wearing a surgical mask, that protects everybody from me if I'm COVID positive. But it also does afford some level of protection to me from other people, while it's not, you know, an N95 or a respirator. So if there is somebody who is COVID positive and asymptomatic, as long as we're doing our best to keep the mask on, we should be okay. And I think that also extends to, I think there was a question about students taking off their masks, even though they're socially distant in the classrooms. I don't think that that is wise, especially given that we know that the virus hangs out in the air for 3 hours. So you don't really want the students taking their masks off, coughing, sneezing, whatever, and then the virus is lingering in the air, and then somebody else takes their mask off, and that's how things spread.
Super. Thank you so much for that great answer. We have some questions related to the middle school experience, before school and after school. I will address I'll go ahead and address that and let Adrienne pop in if she wants to say anything more about that. But for those of you who have had children in middle school or about to have children in middle school, we have both the before care, so to speak, which is the middle school zone area. The students get dropped off by the gym and they stay in that area before they go to their classes in the morning. That will still be the middle school drop-off space. And your children and you will be seeing Adrienne Floro down there when the kids are being dropped off in the morning, and then they will go to their homeroom class. For after school, we will still have clubs. They will be kept in, their middle school cohort and middle school classrooms for those clubs. So homework club and other clubs, all the details of what clubs are being offered are still being determined. And we have discussed the upper school students doing the zone. So we typically have had upper school students that have provided zone supervision for middle school students after school. And what our thinking on this is that we will still have that happen, even though they are part of the upper school cohort, but we will have them masked extra. So we are going to have them with the mask plus with the plastic shield and maintaining the 6-foot social distancing. So that way it's almost like the kind of protection that one would have when you go to the hospital, so to speak, so that those middle school kids can still have zone and the upper school students still have the opportunity to provide that zone supervision. Adrienne, is there anything else you wanted to add to that?
No, I think that's perfect. And I plan to be in the zone every morning to greet the children as they come in. I'll probably be checking some temperatures too, correct?
Yes, indeed.
Yes, thank you.
The other thing is that in terms of space, the multi-purpose room is going to be a dedicated space for middle school. And that space can be a space for clubs. It can be a space for larger classes. So, our 8th grade class is actually that large that we can't have the whole class in the humanities classroom, for example. So the 7th and 8th grade that do humanities together, they will be having that class in the multi-purpose room, and that will be, again, dedicated middle school space. The library is going to be dedicated upper school space. So the library may at times be also a classroom for a larger section of an upper school class. So we've reimagined a lot of how we're using the school to really protect the cohorts themselves. Let's see, there is also a question about plans to maintain sense of community. So I'm going to turn that over to Adrienne and Stefanie. Oh, Adrienne, you're muted. There you go.
Hi.
Steph.
Yeah, so we're hoping to still have Griffin buddies. They'll just have to not interact in person. And beyond that, we're actually still planning, right? So we're kind of looking at things step by step. For example, we are looking at how we could do Carnival, which is a big deal, right? Especially for the littles, and well, actually for everybody. And the upper school kids get so excited to plan it and celebrate that with middle and lower school. And so we're trying to figure it out. Honestly, it's a tough one, right? Because there's like cuckoo interaction happening there. But we are trying. So we are trying to figure out what we can do safely to keep the community together, and have the kids quote unquote interact. But I don't have any specifics on that just yet. Sorry.
And I would say as a brand new person on my third day in the job, I know from afar the importance and the power of the community here at Roycemore. And I just concur with Stefanie that is just a priority. It's an expectation. And we're gonna, just as we've worked tirelessly to plan the reentry and work with our health and safety committee, we're going to do the same thing for school culture, because we know that relationships are number one. That's a priority that, you know, regardless of COVID, we've got to make sure that those relationships are strong and thriving in our school. So I know we're going to put our heads together and engage the students as well. And you know, I'm always about soliciting information from our students because they know what's important and they can help guide us. I know in our middle school schedule, we have a little flexibility on Friday, and that's something we're looking at in terms of community and really focusing on community.
Yeah, I can say already that our Carnival co-chairs are already emailing me with all their ideas. It's really sweet.
There's some questions about sports and tumbling. I'm going to let Adrienne and Stefanie talk about those things, but I am really thrilled that Both Long has joined us as our new athletic director, and he's actually on campus now. He's taking on oversight of our summer programs as well, as we will be building those out in with a lot of greater expanded offerings in the coming years. So he is actively talking with folks at the IHSA who really govern athletic, interscholastic athletics between various schools. And so he's listening in terms of those guidelines, but we also have our own guidelines and what we also feel safe to do. So Stefanie and Adrienne, do you want to talk a little bit more about that?
Yeah, I did throw some stuff in the chat there also if you wanted to take a look, but certainly, basically we are beholden to the IHSA and we're waiting on them for guidelines as to what we can actually do. However, we're moving ahead, right, with hope. So there are already some track meets and some well, up for upper school anyway, some track meets and some volleyball games scheduled. So other schools have hope as well. So, you know, fingers crossed that happens, but of course we can't do anything until the IHSA tells us what can happen. So I wish I had a more concrete answer there for sports, but I just don't. For tumbling is just on pause. There is deep physical connection. That's not right. But there's, you know, the kids are like literally rolling around together and tumbling. And so It's just real tough to do. So we're just pausing it. Certainly not getting rid of it, but just pausing it for the time being. And I know that's hugely disappointing to so many kiddos. But I think it's just what's safest.
Yeah, so I'll jump in here and just add that Both Long is very committed to seeing tumbling continue. So we know that Jessie Wonder has just retired, and I want to be really explicit to say tumbling will continue. In what form it will continue is to be determined right now because of COVID. But I think one of the things that we might be able to do is to allow the kids to work on their tumbling skills where they're not having, where they're not touching each other. So they can practice cartwheels and somersaults and handsprings and things like that, but just not doing mounts and the kinds of things where they're in contact with each other. The other thing is that Both Long is exploring some new sports offerings that could meet the needs for social distancing and just be a whole heck of a lot of fun. So it is his intention to reach out to students and see what their interests are as well, because like most of what we do at Roycemore, it's very student driven. We do care about what they want to do and what they like to do, and we want to hear from them about that. Let's see what else we had. There was a question about, should we ask about family health, not just kid health, and face shields in addition to masks? Dr. Shah, do you want to address that one?
I'm not sure if they mean face shields for the students. I know that the teachers will be wearing face shields from what I gathered from our discussions over the course of the last several weeks. What was the first question? Sorry.
Family health. So should we be asking about family health, not just student health?
I mean, that's a difficult one. I think in the attestations, there is questions about if, you've had a COVID positive exposure. I think it's difficult. I think that responsibility falls on the individual family. If somebody is exhibiting the signs and symptoms of COVID, and you were thinking about getting tested, probably should keep your child at home because they would have been exposed.
Yeah, and Adrienne, if I could just add to that, it is going to be part of the attestation with regard to exposure of people within the household and whether someone has had symptoms. But we do need to be mindful of what we can and can't enforce and where we may cross the line. We don't want to violate someone's civil rights or HIPAA, but we have to weigh that against the health imperatives that are at issue here for the safety of the students and the faculty. One thing I wanted to also go back to was with regard to the air handling unit and the HVAC issues. I want you to know we do have a separate facilities committee on the Board of Trustees where there are a number of architects, engineers, and facility managers that comprise that committee. And we're working in coordination with that committee on these facility issues. Vicki Pickett is very much involved in that as well. And as I said before, we're gathering information and data from a lot of sources that we have to analyze. As you can appreciate, there are many companies, institutions that are making claims of the effectiveness of their products or a system and for lack of better words, taking advantage of the COVID situation to try to advance something that may not be effective. With regard to HVAC issues, the American Society of Heating, Refrigeration, and Air Conditioner Engineers has been looking at these issues. We keep monitoring that. At this point, we say as long as your system meets governmental and industry specifications, which Roycemore does, they don't advocate you turning any of those systems off, and they have not yet come out with an endorsement of any particular either filter or lights that are would be particularly effective. And when we start talking about negative pressure situations, we have to be very careful with that, because with negative pressure, you can also draw back in combustion exhaust gases from boilers that are in the building that can lead to carbon monoxide or other gas exposure, which we certainly want to avoid. So the bottom line is we are collecting and analyzing information, and we're basing our policies and recommendations on those things.
Thank you, Tom. There's another question. If a student is exhibiting any health concerns and chooses to stay home, like the common cold, will e-learning be an option on those days, or will they be treated like traditional sick days? My understanding is that they would be able to participate from home during that, so that they don't have to miss out. But I would like Adrienne and Stefanie to weigh in here.
Yep.
Simple as that. Okay.
That's an option. Yes. So all of our classrooms, right, our classes like Algebra 2, as well as Foundations of English, are considered hybrid. For our definition of that, that means that there will be some students who are there in person, and then students who have chosen the off-campus option, right? So they don't come to campus, but they do participate in their classes from home. And so kids who are homesick, I don't see any reason why they wouldn't be able to join in on that.
Okay. There's another question regarding, and I know that this was addressed earlier, but I'll just reiterate it. So middle school students who are accelerated and taking upper school classes or classes with upper school students, what will happen is the teacher who teaches those classes will alternate between the middle school students and the upper school students. So one day they'll be in class with the middle school students, but then the upper school students will still participate in class, but they will be participating remotely from the upper school side of the building. So they'll be zooming in and still participating, but the teacher will be physically with the middle school students. And then on the alternate days, it will just be the opposite of that, okay? All right, what else do we have here? I think we've got a lot of the questions. Oh, here, another one just popped in. Okay, thank you. Some ideas about fencing and badminton. I love the ideas. Keep sending them our way. That's great. Cross country, yes, cross country will happen. One of the, cross country is actually one of the most obvious sports for us. I think one of the things that we're also still trying to gain an appreciation for has to do with transportation to the meets. So, you know, typically you would put the kids on a bus and transport them to the meets, but we have to have still the ability to socially distance in the transportation. So we may be doing some brainstorming with parents here to help with transportation. That might be a way that we all come together as a community to make it happen, that we have a bus taking some kids and we have some parents taking their own kids to the meets. So those are ways to make it work. There's a question about the size of the 8th grade and 7th grade class. Currently the 8th grade is 20. It can get up to 25 based on how we have, since we've already said that the multi-purpose room is going to be dedicated for 7th and 8th grade, but the 7th, 6th, and 5th grade classes will be limited to, I think, 15 or 16, so that we can keep the cohort as a total of 70 or less. Right now, the middle school enrollment is already at 60, and we have inquiries coming in left and right now. Let's see, question about, can students choose 100% on-site and also do remote learning as an option, hybrid? No, we're not recommending that. We really want students to commit. It's really difficult for our teachers to plan for students who are wanting to come in, you know, just for this class or not for that class. And also, quite honestly, some students can try to use it to their advantage and say, well, this day I don't really feel like coming in. I think I'll just participate remotely. And that's not helpful to the trajectory of their learning. So, you know, once you select the on-campus option or the off-campus option, we're going to ask that the students commit to that. And the only reasons for them not being on campus, if they've chosen the on-campus option, is if they're sick or if they have symptoms that prevent them from being on campus, but they still are well enough to participate, then they could do that through the Zoom classes. Or if there were a positive case of COVID, let's say there was a positive case of COVID in the upper school, and all of the upper school goes into quarantine for 2 weeks. Those middle school students still come to campus, but their teacher will be teaching that class remotely during that 2-week quarantine. And the middle school students would be here and they would Zoom in to those classes. And the question, if a student is really sick, can they just take a sick day too and not be expected to attend remotely? Yes, kids can still be sick and have a sick day. There's a question about restroom cleaning. Let's see. Has the school developed a plan, RE, enhanced cleaning of restrooms throughout the day? Will restrooms be cohort specific? So yes, restrooms would be cohort specific, just like we've dedicated space in the building. And we won't be having the kind of deep cleaning throughout the day, but high touch areas would be wiped down during the day. Okay, I think that is most of the questions, and we are just after 6 o'clock. So I want to, again, thank Dr. Shah and Tom Ellis for joining us from the Health and Safety Task Force, and Stefanie Rivera and Adrienne Floro as our division heads. We really appreciate all of the families that have joined in tonight. And if you have further questions, you know how to reach out to us. So thank you again, and we look forward to seeing your children back on campus in just over a month. All right, bye all.
You need help?